All right, let's talk about something that can be really confusing. If you've ever thought about getting a clearer picture of your mental health or how your brain works, you've probably heard of psychiatric and neuropsychological evaluations. They sound kind of similar, right? But honestly, they're worlds apart in what they do.
So, the big question is, which one is right for you? It's tough to know which path to go down. Are you looking for help with your mood, maybe to see if medication could help? Or do you need a much deeper dive into how your brain is actually wired and processing information? Well, that's exactly what we're going to clear up today.
Okay, let's break it down from the top. At the most basic level, think of it like this. A psychiatric evaluation is essentially a medical assessment. The main goal here is to get a diagnosis and see if medication might be a good option. A neuropsychological evaluation, though, that's a whole different ballgame. It's a true deep dive, all about understanding the nitty-gritty of how your brain thinks, learns, and remembers things.
To really get to the heart of this, we're going to break it all down using a pretty simple framework. Who is doing the evaluation, how they actually do it, and why would you need one instead of the other? Now, this table right here gives us a fantastic, quick look at the two side by side. We're going to walk through each one of these rows, from the provider you'll meet to what you walk away with, so you get a really complete picture of just how different these are. First up, the provider. Who are you actually seeing? For a psychiatric evaluation here in Arizona, you're meeting with a medical professional, a psychiatrist or a psychiatric nurse practitioner. They're looking at things from a medical, biological point of view. But for a neuropsychological evaluation, you're seeing a psychologist with a doctorate, someone who's a specialist in how the brain and behavior are connected. So right off the bat, two totally different training backgrounds. And here's a really big difference: the time. A psychiatric evaluation is pretty quick, usually just an hour or two. A neuropsychological evaluation, that's a serious commitment. We're talking a half day, sometimes even a full 8-hour day of focused testing. So this brings us to the why. Why are you there in the first place? With a psychiatric evaluation, the main goal is to figure out a medical diagnosis, like anxiety or depression, and see if medication might help you feel better. The goal of a neuropsych eval is completely different. It's all about mapping out your brain's unique cognitive profile, pinpointing exactly where you shine and where you might be struggling a bit. And what you walk away with is just as distinct. From a psychiatric evaluation, you might leave with a prescription or a new treatment plan. But from a neuropsychological evaluation, you get this incredibly detailed report. I love this metaphor. It's like a personalized roadmap of your brain, with clear, actionable recommendations for therapy, school, or even your job. Okay, so we've got the basics down. But what does it actually feel like when you're in the room? Let's pull back the curtain and take a peek inside the evaluation itself. The way they go about it is fundamentally different. A psychiatric evaluation is symptom-based. Basically, you'll be talking, answering questions about your history, your mood, how you're sleeping. But a neuropsychological evaluation is performance-based. You're not just talking, you're actively doing things, solving puzzles, memorizing lists, drawing shapes, to directly measure how your brain handles these tasks. A really good way to think about it is this. The psychiatric evaluation is a deep conversation. The neuropsychological evaluation is a workout for your brain. You're not just telling them about your memory. They are actively putting your memory, your attention, and your processing speed to the test. Okay, now let's make this really concrete with some real-world examples right here in Arizona. When would someone actually need one of these over the other? So, in a legal setting, especially for something called Title 36 or court-ordered treatment, a psychiatric evaluation is the go-to. Its job is to medically determine if someone's mental state makes them a potential danger, which is obviously a crucial question in court. Now, when it comes to getting help at work, the tables turn. Arizona's Department of Economic Security, or DES, often needs a neuropsychological evaluation. And why is that? Because that detailed roadmap is exactly what's needed to figure out specific and fair accommodations for someone who's dealing with a brain injury or a learning disability. And it's the exact same logic in schools. To create a really solid individualized education program, an IEP, for a student, you need hard data. You need to know why a student is struggling. The Neuropsych Eval provides that super detailed data on things like processing speed that helps build a plan that actually works. Okay, we've covered the professionals, the process, and the real-world applications. So let's bring it all back to you. How in the world do you decide which one is the right next step for your specific situation? let's make this super simple. A psychiatric evaluation is probably the best place to start if your main concerns feel emotional. If you're just feeling off, you're dealing with mood swings or anxiety that won't quit, and you're curious if medication could help, this is definitely the path to look into. On the other hand, you should really be leaning toward a neuropsychological evaluation if your concerns are more about your thinking. If you've had a head injury, if you're noticing some scary memory issues, or if you need to untangle a really complex case of ADHD or autism. To understand how you or your child truly learns, this is the one that's going to give you the deepest answers.
At the end of the day, both of these are just incredibly powerful tools. It all comes down to what questions you're trying to answer about yourself. So I'll just leave you with this final thought. What could having a detailed roadmap of your brain's unique strengths and challenges really reveal for you?